There's certainly more awareness about mental health and diagnoses of anxiety and depression in teens. That's no secret. But these statistics hammer that point home. The second leading cause of death for children is suicide, and major depression in teens has increased nearly 300%. This is all according to Jonathan Haidt, a social psychologist and author. He says in the last decade, self-harm among girls aged 10 to 14 has also increased 188% in the form of emergency room visits. When faced with this epidemic, experts say it's about teaching teens to bounce back.
Resiliency is huge. We talk about no one's life is perfect. I mean, with social media, life looks perfect to a lot of us. I'll ask the kids who's had a problem today, and every hand will go up.
At Forest Hills Central tonight, a public panel featuring district leaders turned to mental health. From school resource officers to reentry plans for students hospitalized for depression or anxiety, the positions and policies that exist today weren't always a reality for Counselor Reynolds when she was in school.
Well, I think kids need a lot of support, like mental health support, so they can be resilient. I don't think that's a skill that's just naturally had. I think it's something that needs to be taught and practiced and learned.
For this parent, there's frustration in the difference between 504 plans and IEPs. Both terms refer to specialized education plans for students with disabilities. But at Forest Hills, Wilson Fisher says social workers are only provided to those with IEPs, and she'd like to see students with 504s have access to that same help. The district said that, like a family, they're always working within their means. In Forest Hills, Sam Lanstra, Fox 17 News.